Alright guys, I'm here for the emergency alert system because there's a tornado watch in my area. It's 1 p.m. I don't know why am I gonna do this. So, I'm watching TV and I'm waiting for the emergency alert system to come up. And I will say, yes, it's coming. Oh my god.
What you need to know right now. More than 557,000 confirmed cases of coronavirus across the country. Arkansas is one of the few states without a stay-at-home order despite the rise of COVID-19. The governor of Arkansas is here with what's behind that decision. New insights on what it means.
Alright guys, so let's go with it. Alright, we're watching TV.
And now that masks are a must, some easy ways to make your own. Plus, changing rules on the home front, co-parenting in the coronavirus crisis, Wayne Brady's family taking social media by storm. And from Miami, the new anthem for a coronavirus world. Now, from ABC Studios in Times Square, Amy Robach with What You Need to Know. Good afternoon, everyone. Thanks so much for joining us, and welcome back to a new week on What You Need to Know, and we're so happy you're here with us on this Monday. The big developments we're tracking right now around the globe, the number of diagnosed cases climbing to more than 1.8 million, at least 22,000 deaths here in the United States, with more than 92,000 people hospitalized. With me now is ABC News Chief Medical Correspondent Dr. Jen Ashton. And Dr. Jen, we know over the weekend we heard from Dr. Anthony Fauci, who said he was hopeful we could cautiously start doing a few things the way we did before the pandemic. What do we know about this potential return to normalcy?
Well, Amy, we tend to hinge on every word Dr. Fauci says, and for good reason. He is literally a legend in terms of infectious diseases. And at this time, what we know is that there has to be an endpoint. We cannot sustain this degree of social distancing and shutdown forever. But we also know, just based on science and medicine, that if we just rip the Band-Aid off, set a date, and flip a switch, as Dr. Fauci said, if we come back off this too quickly and too abruptly without certain plans and procedures in place, the numbers will go up again, and unfortunately people will die at higher numbers. So then what do we think will help to get us back to at least some familiar activities? Well, the thought is that it all will be on testing to figure out who is susceptible, who is infected, and who has recovered. That widespread and mainstream testing is going to be incredibly important, and that information...
Hello, good afternoon, everyone. I'm Brian Taff, interrupting our colleagues at ABC News once again, as we have been, to bring you the very latest from local officials as they detail the situation with regard to coronavirus and the local response to it. Philadelphia Mayor Jim Kenney has just begun speaking. Let's listen.
Fourth COVID-19 response package. We need the federal government to provide support in additional ways. We need direct and flexible funding. The two most effective forms of relief that can be offered to local governments are providing direct, flexible funding and replacing lost revenue from this crisis. Without this, we will be forced to make drastic cuts, which will deprive residents of needed services, exacerbate the damage to our local economies, and lessen the possibility of a speedy economic recovery. We also still need personal protective equipment and supplies. Federal authorities have indicated that the greater Philadelphia region is at risk of a surge of COVID-19 infections. That is why we urgently requested personal protective equipment and resources to expand rapid testing capacity. We also need housing support. Nearly 300,000 Philadelphia households face housing instability. The COVID-19 health crisis has magnified the housing need, with low-income renters facing eviction and homeowners facing mortgage payment crises. We're asking for rental assistance for low-income people and people with disabilities, mortgage leniency, drinking water and wastewater assistance programs, and other measures to protect renters and homeowners alike. The government also needs to support our most vulnerable. We need additional resources to meet the basic needs of those who are the most vulnerable. We ask Congress to increase support for Medicaid, SNAP, and TANF, as well as provide flexible emergency assistance for homeless services and increased support for unemployment programs. We also cannot forget about education. We need more than the CARES Act to stabilize education and to close the gap in learning due to schools and institutions being physically closed.
Yeah.
Comprehensive education solutions include immediate and long-term investments in early childhood education, K-12, and higher education. We also need federal support in job training and retraining to help the many adults who will lose their jobs and need support to improve their education and skill sets. Our letter also asks for additional small business relief. Vigorous support to small businesses, including the need to significantly expand the economic interventions from the first three coronavirus packages. Our requests include business disruption insurance, increased funding for the SBA payroll protection program, an employee retention tax credit, emergency family medical leave, emergency paid sick days program, paid leave tax credits, loans and grants, and direct aid to airports. We also need to make sure we have fair elections. Pennsylvania recently established universal vote by mail ballots, which will be available for the first time in the upcoming primary election.
So this doesn't stand for everybody. Bob should get it.
The system will be critical to reduce the risk of virus spread.
He should
At the same time, social
get the sick
distancing will
leave
make
too.
education and outreach efforts
You
much
know what I
more
mean?
difficult, and voters without internet access.
I mean,
will need
even though he
additional
has
support.
no time left on his sick leave,
Philadelphia needs more funding to
but they
ensure
should
that everyone
extend
can
it.
exercise their right to vote in the upcoming election and elections going forward.
means this is going on,
And
you know.
finally, we need to see pension relief in the form of funding for state and local pension funds.
goes to work tonight,
Philadelphia has made
Yeah.
significant progress on our
Which he
pension
really
reform
shouldn't,
plan and
because he
strengthening our
has
pension
those
fund.
stents in his
However,
heart.
the sudden downturn in the markets in March led to substantial losses for public pension funds.
So he's
nationwide.
high risk. You know what I
We thank
mean?
Speaker Pelosi and members of
Them
Congress
taking him back
for
to work,
acknowledging
he's
the
high
receipt of
risk.
this letter, and we look forward to working with them all on all these important
That's
issues.
why I don't
moving
understand
forward.
why they would make him go back.
In the meantime, we continue to fight the spread of the virus. The city's emergency operations center, coordinated by the Office of Emergency Management, will expand its operations to 24/7 starting tonight. EOC was activated March 11th, connecting over 25 agencies
Business.
for 16 hours a day
You know.
to support
Yeah.
key city operations, public safety, public health initiatives, healthcare operations, and public information. Philadelphia Police, Fire, and OEM's Regional Integration Center had been active 24/7 since the very beginning. EOC is now increasing capacity for two main reasons. The first is to manage operations of our response-related sites. The second is to manage operations of the Leah Center as it becomes closer to being operational and taking on patients if necessary. The Emergency Operations Center serves as the nexus to the city's COVID-19 operation, connecting the city's response to the Unified Command Group and all the stakeholders. EOC is physically staffed with a third of the personnel who would usually be in the room to promote social distancing as others work remotely. Its expansion to operate 24 hours a day means that we have even more resources overnight to respond to COVID coordination issues. I want to again thank all the city employees who are working around the clock as we continue to fight the spread of COVID-19. I also want to remind everyone that today's meal and food box pickup were delayed due to the severe weather. We didn't want to put anyone at risk standing outside in these conditions. Meals and food boxes will be available tomorrow, Tuesday, April 14th, and again on Thursday, April 16th. I know there are many families relying on these sites, so we appreciate the media's help in getting this change out to the public. We'll return to the regular Monday and Thursday distribution schedules next week. As always, we encourage folks to visit phila.gov/COVID-19. That's phila.gov/COVID-19 to see a list of locations for the city's food sites and the school district student meal distribution sites. Last Friday, we announced that the deadline to submit applications for funding from the Philadelphia COVID-19 Small Business Relief Fund is before midnight this Wednesday, April 15th. Before